to sponsor. So thank you. Anyway, we will have a luxury senior living right in Alexandria for independent living, assisted living, and memory care. And we'll open early February next year. Have already started taking deposits, which is really exciting. And then we've also opened Providence and Fairfax, and we're opening Rockville next month.
Great. And one of the things that we've talked about on this monthly sponsorship and partnering with you is I'm going to try to make some remote appearances at these various locations. So Kitty, hopefully I can come down there to your sales center and we'll kick off one of our discussions down there with a live tour of what you're offering. So
that would be great.
This is great. Well, yeah, and again, just so you know, we got the landing that's coming up in Alexandria. We got the Providence that is open right now in Fairfax, and then the Seneca, which is in Rockville, and that's going to be opening next month. So really excited to have this new set of providers here in the DC, Maryland, Virginia area.
Thank you.
Yeah, Kitty, just drop your contact into chat there so folks can get in touch with you.
That sounds great.
All right, great. So now we're going to tuck Kitty behind the curtain, and I just have one more slide before we can bring on our panel, or two more slides before we bring on our panel members. The first one that I want to just kind of give you a glimpse at what we've got coming up for the rest of the month. This is a great month, but tomorrow, definitely tune in. We have a company that's in an FDA trial, and they've got a device that is that provides treatment to people with Alzheimer's disease and cognitive impairment. So really excited to have those folks on and hear what they have. Next week, we'll be meeting, have a panel of elder law attorneys that you can meet. We've got a partner panel on what to do in a health crisis. And then the, really, if you're in Virginia, or if you've got clients and loved ones in Virginia, tune in next Thursday, because we're going to be learning about a Virginia Medicaid waiver program that you can actually activate. It's not a 2-year waiting list. And then we're going to also learn about reverse mortgages next week. So that got a great week coming up next week. A reminder, proaging.com is where you can access all of these recordings. You can see what we've got coming up on the calendar. You can do a provider search. We've got a career center. And if you scroll down, you can browse or order free copies of Positive Aging Sourcebook. Okay, well, that's my housekeeping. I am thrilled at the positive reaction we've been getting to these panel discussions, and especially charged up that we're introducing people that didn't know about this great profession of daily money management to folks. Today we've got Mandy DesBarres. I know I botched her last name. I failed French. And Kay Bransford. Mandy's with Help Unlimited, and Kay is with MemoryBanc. And if I could ask the two of you to jump on the screen here, we can get to know you a little bit better. First off, thanks for joining us today. I'm really excited to let our audience get to know the two of you. I feel like I know you all pretty well, but I've known some other people I've had on these panels pretty well, and a lot of things that I didn't know about you came out of these discussions, so that's great. But let's first sort of get to know the two of you. Mandy, tell us a little bit about yourself, your organization, and what you do as a daily money manager.
Oh, okay, thank you, Steve. So Help Unlimited is a company that has offices in the DC metro area. And then we also have an office in Charlottesville, Virginia. And we offer daily money management services in Charlottesville and also all over the DC metro area. I have a staff of about 12 people. And basically, we've been delivering daily money management services since 1985. For me, this is a family business. Daily Money Manager was my first job out of grad school, and I've been doing this for almost 20 years now, which kind of surprises me when I say it out loud. But my mother was the original owner of the company. Her name was Roberta Gosier, and she offered me a job when I was trying to begin a fledgling career as an opera singer. And for me, this was a great job because I could go and see my clients during the day, and then I could sort of arrange my appointments around my audition schedule. And then as time went on, I just really loved the work. I loved my clients. I got on the job training from my mother, and then through professional development courses through our Association for Daily Money Management, AADMM, we like to call it. It's the American Association of Daily Money Managers. So I had professional development through that, but I also had a lot of professional development through my clients. I worked for a lot of extremely intelligent retirees who wanted to hire a daily money manager to assist them with the day-to-day activities of managing their household finances. And many of my early clients hired me to do this, not because they weren't capable of doing it, but they didn't want to do it by themselves. They wanted to have a partnership with me where I would carry out the drudge work, the phone calls to the credit card company to say, what's this charge? Or they wanted me to keep up with their spreadsheets and do their Quicken data entry. So I learned a lot from my clients. And
Oh, man.
But anyways, I mean, for anyone who's not familiar with daily money management, and I'm sure we'll get into this more, we assist older adults, individuals with disabilities, people who are busy professionals and want to keep up with their finances but don't have a lot of time. They hire us to assist them with those tasks. So if somebody walks in the room and asks the question, who's paying the bills and managing the household records, and where's the next checkbook, and who's balancing the bank statement? If you have a daily money manager involved, those are the kinds of things they'll raise their hand and they'll say, I know where that is.
Oh,
I reconciled that statement. I can tell you what the monthly income is, all that day-to-day stuff.
no, I love it. And I had the good fortune of knowing your mom, and I got into this business in 1990. So your mom was truly a pioneer in a profession that didn't even have a name back then.
Yeah. And back then, that was when the association was getting started, and some people really wanted to call us financial organizers, and some people really wanted to call us daily money managers. My mom really wanted us to call us daily money managers, and that's what we ended up with.
That's
but
great. No,
I think
that's
a lot
great.
of people,
And I'm glad that you basically have lived up to what I said earlier. I had no idea that you were a trained opera singer. So that's great. So Kay, you're another person that I've known for many years, and I remember you launching MemoryBanc. You've are a daily money manager, but tell us your story. And you have some unique product offerings that your organization offers as well.
Yeah, thanks. I started in corporate America. I'm the baby of the family, so I did not think I was going to be the one helping mom and dad. And I had two parents that both ended up with different forms of cognitive impairment. My dad had Alzheimer's, my mom had vascular dementia. And so we didn't know where things were. I was the only child in the area. My sister, the lawyer, was in California, who was the power of attorney. And so things were just a mess. So part of my journey was really, how do I help my mom and dad still work, raise 2 kids, and do all these things. And my parents were really organized. Dad was military, so they were always ready and had things documented, but nobody wants to go through 4 file folders. And they had file folders in 2 different households because at that point they had moved into the Fairfax. And I still remember the article you did, Steve, when you went and lived in the Fairfax. I think that was my first exposure to you, was seeing that. And like, that was such a cool story. And I didn't really even know there was this community of professionals serving older adults. So I was that caregiver. I ended up creating these tools to get organized. I entered a AARP business plan competition because I came from marketing and business development, and that's what you did. You created a business plan and you pitched it and you got people to contribute to the idea. So I really launched as a products company initially. And I started doing all these talks about what do you organize? Why do you organize it? Why is it important? I interviewed insurance agents, financial advisors, elder law attorneys, and I really wanted to understand what was that general content that you needed to have all your information in place. And I got invited by the American Association of Daily Money Managers to come talk to them. And I was telling them the work I was doing with all these clients, organizing information for them. And they were like, you're a daily money manager. And I was like, I don't know what that is. So it's such a welcoming group. They brought me into the fold. And I started serving clients in a different way and doing more bill pay. And I've been doing this now for 10 years. About 5 years ago, I realized that I was a single point of failure for my clients. So I started to hire a team. And so now we have a team of us that serve older adults. My specialty is really with adults with cognitive issues. That's just kind of my soft spot. And there's some nuances to working with those kinds of individuals. There's lots of fraud and scams that they're particularly vulnerable to. So that is really how we got started and how we've grown. But some of us go in and help someone do a home renovation. During COVID, we've had people move out of their homes and we've managed a home renovation for them. So we've done a wide spectrum of individuals, from the household management to the bill pay, all over the place.
No, that's great. And I'm glad you gave that explanation, because I do remember when you were first launching, and I did not categorize you in this space. And it's great to see, all of us in business have gotten used to modifying and pivoting and doing all that with COVID-19. But it's as entrepreneurs, both of it's something that you just do and modify. So let's okay, so we got to know the two of you. So let's dive into some ways that your organizations can help clients, whether they be families or loved ones, or if you're a senior serving professional, your clients. And this is where I also remind our audience that we love to get your feedback and questions for our panel members. So feel free to type those in via Q&A or raise your virtual hand, and we can throw those in. I think one of the benefits, and Mandy sort of alluded to this, is that when somebody comes into a home and they're sort of like, let's say you're an adult child and your mom is in the hospital, she just got back and she's not feeling well, and you've got to sort of start figuring out where the money is and help her pay her bills and all this stuff. And it's sort of like, where is everything? What you realize is that if there's not somebody that can answer that question, you can be pretty susceptible to fraud. And maybe there's been a lot of in the press lately about fraud against seniors. Maybe let's kind of kick it off with that. Is that, how do daily money managers help your clients or people out there address the issue of fraud?
Well, I'm happy to jump in on this first, but I'm sure Kay has a lot of thoughts as well. In my experience, So we are sometimes brought in when there have been cases of financial exploitation that took place, and then the individual is having to unravel from an event, like they had a person in their life who was routinely taking money from them. And since there was no oversight, the practice just kind of continued. And so we've been brought in sometimes by social workers because they became aware of this happening, and they, just by having a daily money manager involved, just everybody that works with that particular senior knowing that there's a daily money manager who's paying attention, who's looking over receipts and looking at the credit card statements and really keeping an eye on things. I do feel that sometimes that helps a lot. That there are so many sources of exploitation that can take place. You have people that are in the senior's life who can come in and start taking money. And then there are all the things that can happen to them through, some sort of call center in the great yonder that calls them up and convinces them over the phone to give them information. And then all of a sudden their banking information has been compromised by an outfit that is, we have no idea where it is. Or there's some sort of internet scam where they respond, they send money, or they disclose information. So then you have compromised accounts, and you have to sort of go through and decide whether these accounts can even remain open. Do things need to be shut down and whatnot? So it's always with each person, it's always a little different how it happens. But I do think that I think as daily money managers, we become very familiar with what the person's assets are, what their bank accounts are. If they have a lot of accounts, I think most daily money managers encourage their clients to simplify their financial lives so that it's easier to monitor what's going on. If you have a lot of accounts, it makes it harder. So I think daily money managers go towards that sort of organizing, streamlining, making it easier to review the accounts and decipher things, and just keep it organized so that you can see things more clearly.
Yeah, now as you were talking, it just dawned on me, it's sort of like, it's probably a really challenging thing for the first time when you meet with a client and they're sort of turning over this information to a stranger, so to speak. What I'm assuming that there's a standard of sort of license bonding, insuring, and protection when you're working with a daily money manager, so that people can trust people in your profession, or an ethics review type thing.
Yes, absolutely.
Yeah, as members of the American Association of Daily Money Managers, we do go through a background checks. Most of us opt for the additional insurance. Several of us also have bonding added for us. Sometimes we're required to bond for certain accounts if we're a trustee. There's many things that we do along the way. And in general, I would say, and Mandy, you probably have the same experiences, many times we're referred in by a trusted advisor to our clients. So the advisors telling them we're trustworthy, they know we've been in the community, we've been providing these services, they've seen our work with others, and we come in, we have the insurance, a code of ethics, and we have agreements where we also contractually agree to your confidentiality. So I would say we have all those things in place, but I would see if you would agree, Mandy, is most times when I walk into a client and you're having that initial conversation, there's something that's gone on. And in that first few minutes, we'll make a statement or we'll go, oh, did this happen or did that happen? And you immediately are able to build trust because they understand that we walk in and we actually are sitting side by side with them, and we've already been through it. We know what it's like. It's very common, for this fraud to happen or these things to happen. So we can immediately kind of build a rapport with them around the situation or the thing that they're facing.
Yes, Kay, I couldn't agree with you more. Like you just, there, and there's, what we are providing them with is a professional service, and we have a background and knowledge, and very early in the relationship, a competent daily money manager can convey that even though this is very overwhelming for the individual themselves, it's not overwhelming for us. We've seen it before, and it's not our money. It's not emotional for us. It's really just defining things, and then, you know, figuring out the mechanics of the most efficient way to keep everything, all the ducks in a row. And, you know, so
Yeah.
it's not, for them, it's emotional.
You know,
But for us, it's our profession.
yeah, and Kay, you just touched on this. Actually, yesterday we had a panel with aging life care and elder law working together, and you talked about professional referrals. Again, that's a great way to provide introductions that where there's more trust and connection. But maybe for the two of you, let's talk a little bit about how you work with other providers and professionals. One of the things that I've seen over the years in talking to daily money managers is because you were working side by side with the client and their family, and you begin to hear other challenges and problems that are outside the scope of a quote unquote daily money manager that you're providing them with solutions to and introductions to in your network. So maybe talk a little bit about how you work with other providers a little bit.
I guess I'll start that since I sent yesterday. I called it the senior dream team, and there's individuals that I consider core referral partners and trusted. I mean, they're trusted colleagues, really, because we want to work across, you know, to the CPA or to the financial advisor or an aging life care specialist. There are a variety of people that we pull in and draw on as we're facing a crisis for a client, or, you know, they want to sell their home. Sometimes we need to bring a realtor in. So to me, there are a variety of individuals that naturally come into the fold as someone is aging and as they need to start making choices that involve money. So we actually probably touch many of the professions already out there, just because money's almost involved in everything. So I don't know what do you think about that, Mandy?
I mean, yeah, like you just said, you talk about core individuals that become sort of part of the team. I definitely agree. It becomes, you know, I think that the money, yes, comes into play and across a wide swath of people's financial lives, their legal lives, their, you know, their investment lives, all of this. We have some sort of involvement if they're working with a aging life professional. That, you know, how are they going to pay for the care that's being recommended? Do they have long-term care insurance? All these things are going to start to come into play, and then that's a question that somebody's going to turn to us and say, well, is there long-term care insurance? Are there funds to pay for this facility? It's sharing information across the professions to facilitate whatever needs.
I was able to pull up that image that Kay put together, and I'll just kind of walk through the dream team here. I think this is a really good, a great graphic image. You've got financial advisors, CPA or tax attorney, elder law attorney, aging life care manager, Medicaid advisor, mortgage advisor, realtor, or realtor. My mom always corrects me when I say realtor. And daily money manager, and the daily money manager. And yeah, this is a pretty neat collection of professionals. Do either of you or both of you want to comment on sort of like a relationship that you may or may have had with somebody on this image that you felt was beneficial, maybe a story to tell on how you helped a client using some of these providers that we have on the screen? I love putting people on the spot. I didn't even tell you that I was doing this here. So,
No, it's a great question. I think I have to say that just when we talk about teams, I think that seniors are really well served when they have each of these people. And I find that a lot of times I've just had a lot of experience where sort of I was kind of the first one in with, I would say most of the time I'm being brought in by an aging life care manager. And so a
yeah,
lot of
and nobody has looked like there's no financial advisor. There's ideally.
So a lot of times it's me reaching out to these professionals who are perhaps they are in place in the individual's life, but they didn't know that the client was suffering from a cognitive decline, or their job was to just move over money whenever the client called, and they didn't know that a lot of that money was going to an individual claiming to be a priest and who they were just giving money to because that person regularly visited them. So I've had some very meaningful relationships with financial advisors who were just kind of, we're unique because if you look at this, if you look at this dream team, a lot of these individuals aren't going into the home like we are, and so we're where the rubber's meeting the road, right? Like we're walking in and seeing like a stack of papers that's kind of a mess. There might be uncashed checks, all sorts of things, and so then we're having to say, oh, well, that's great, you have a financial advisor, but like, do they really know that all this is happening? And do they? So I don't know. I had a very significant relationship with one particular financial advisor who, because the client gave me permission to call them and sort of update them on the client's situation, they were better able to understand that the client was essentially going into a period where they would have to spend down their assets without any kind of, they just needed to be made aware. And so then we could sort of work together and talk about it and do it in a purposeful way rather than just piecemeal. Here's $25,000, here's $10,000. So
no, this is really good points, Mandy. And Kay, any thoughts on you created this this? I think one of the things that Mandy is speaking to, and this is really important, especially because we've got providers that are in the difference between a professional, being a professional in their field and a professional that's focusing on older adults and their loved ones. It's that more intimate knowledge of what's going on in that person's lives. Like as Mandy alluded to, if you've got your TD Ameritrade financial advisor, he has no clue about your health, wellness, or what have you. And that's the difference between the professionals that choose to focus on this population. But Kay, I'd be interested in your thoughts on your image here.
Yeah, and I guess some of it started as there's two that I work with quite a bit and in different ways. So one was kind of the elder law attorney. So many times, either I'm bringing a client to them because I'm looking over their papers and going, this is out of date. These are really old. We need to update them and refresh your estate plans. But I'm also having lawyers refer back to me clients that need more, they want side-by-side help in the home, and the lawyer's not going to do that. So even though the lawyer might be their power of attorney or their trustee in their estate plans, the individual is still writing checks, but they're a single person and they need a little bit more help in the home. And they want to have more, I call us the money buddy. They just want someone who they can trust to talk about, that Mandy brought this up earlier, is they want someone to be able to come in and be able to have these discussions with, which contractor do I go with? I want to redo the roof. How many bids should I get? So we get involved in way more the day-to-day finances. And many of the estate lawyers that I work with will refer clients to us, even though they're powers of attorney and trustee, because they know I can go in there and I can take care of something to make their client happy. And they don't need to use the lawyer for this type of thing. The other client, I don't know, were you going to say something about that, Steve? I was just going to mention the aging life care manager
Oh,
too.
no. Keep on
Oh,
going.
okay.
Yeah.
So in the aging life care manager, that is one of the best partners. And I'm sad when there is a health issue or there's cognitive things and there isn't that individual involved, because I know as the adult daughter that did this, I can help mom and dad, I can get them to their hospital appointments, I can do all those things. But there are many times I actually called an aging life care manager to come help me in the emergency room when they told me I needed to lift the DNR for my mom because she broke her hip. She's got moderate dementia and she was not going to survive having a hip operation. And she would have been really mad at me had she known I put her through that. So I was like, what do I tell the doctor? I mean, there's so many things that you just don't know, that you learn, that we've learned as daily money managers, and seeing these other realms, that I am appreciative of those aging life care managers, because when it comes to medical issues, there's so many nuances to it. And there's things that we pick up. The other day, I saw on a client's credit card, like a CVS pharmacy bill for a medication. And I was like, aren't they getting that pill delivery service? Why is this other medication being filled? So I can easily call them up and go, hey, I see something on the bill. I think something's up. And they didn't know. The antibiotic was prescribed and they weren't even involved. So I love to have that relationship, because I look to them as my team. We're all working together to make this person's life better.
I love it. No, and I also love the fact that questions are coming in fast and furious. And actually, this is a good one for you. That was just emailed me by Patricia, and she asks, how long do we need to keep insurance reimbursement forms and things like that? Do you guys know the rule of thumb on something like that?
I mean, I would say until you get reimbursed at least. And then if you need it for tax records, it follows the tax record rules.
And what are those tax record rules?
So in general, it's 3 years for most Americans. Everyone believes this is 3 years plus the current tax year you're filing for. 7 years is if you have more complicated stock trades. And Mandy, you can update me, refine that, but usually it's the 3+1 rule, or 7 years you're keeping your tax records. And you don't have to physically keep them. You can scan them and create digital copies, so you don't feel like you have these boxes following you around. If you ask your accountant, you can also call the IRS. I've called the IRS to ask them how long to keep something, and they, I guess before COVID times, were very good at and very helpful with that. If every time I found I've asked the accountant, they said keep them forever, which is not helpful.
Or practical, people have finite amounts of space to keep paperwork.
Yeah.
I mean, and I've had CPAs tell me that the actual return, yes, you should always keep it. But I operate by the same rule of thumb with this. It's 3 years for most people, but to be on the safe side, I always say 7, and that's from the date of filing. So if you didn't file it on time, you need to go by the date that you filed it. I've had clients who I came in and they hadn't filed tax returns for 4 or 5 years. And so for them, that date to get rid of the return, it's not based on the tax year, it's based on when they submitted it.
Yeah. So Patricia, make sure that you file your taxes, and then you may choose to keep that for 3 years. But then we do a whole series on downsizing, moving, and decluttering. And so these questions come up there as well. Let's see. Well, actually, a couple of questions came in. So Kay, we got a question that was emailed to me earlier today from somebody who, I guess you've published a book that can help people through this process. She purchased that book. She went through the whole thing and she's wondering, is there somebody that can give her a hand with questions on this book? Maybe tell us about the book, and is there any additional support that one can get to the elements in the book?
Yeah, so the book I wrote was actually part of the AARP business plan competition. It was meant to provide older adults that don't have a ton of money with a system and tool that they can use to manage their affairs. So it's a book of everything, and it was a book of everything that I needed for my parents, that even though they had complete plans, long-term, all those things in place, and they had the means to pay for it, the information is required for every adult to manage their lives. And what I did was, as you probably, when you first met me, is I published this book, and I have a binder system, and there's a PDF version, there's digital versions for people to use whatever means they like to keep their information, but people still have to do it. And so we get that you don't want to do it. Often other daily money managers will use our tools to help their clients, and they'll help fill out that information. They may have their own kinds of systems. But we do actually have a service where we come into our clients' homes and we will help them finish that information, or they can even package it up and mail it to us, and we digitize it and send them back a pretty binder with everything ready and at their fingertips. And we do annual updates for them as well.
Okay, so, and I just dropped a link to that page on your website into chat. And I'm also dropping a link for Help Unlimited, Mandy's company, as well. But to answer that question from earlier today, give MemoryBanc a call, and you can connect with her on follow-up. Okay, and let's see. Okay, Deb Merrimer says, should one of our clients need a conservator, would either of you consider acting in that capacity?
So I guess it depends. Is it a court-appointed situation, or I'm actually named power of attorney or trustee for many of my clients? So it's actually through the estate planning vehicles. I have not gone through the court appointment system process, which would, to me, is the conservator part. But I actually work with lawyers who do that, and I actually do all the reporting for them. So it's kind of another partnership that I have with estate lawyers, where they are the legal front and I am the back end reporting on all the finances.
I help my clients in a similar way, where I don't take on power of attorney or trusteeships for my clients, but I very frequently work with people who have been named in that capacity, and I will do all the sort of drudge work of that, of being that.
Fun stuff. Come on,
Yeah.
Mandy.
Well, I really like sitting with my clients and, having that face-to-face meeting, and the data part is so important, and it's a big part of what I do. So I help people that have been designated as power of attorney or trustee, but I don't take it on myself.
Okay, and what a faux pas. This is the problem with me trying to do a million things at once. Folks.
Yes, I know you put up the number for Help Unlimited temporaries, which I have on my phone. I have it on a little sticky so that I can say, no, you were trying to reach Help Unlimited temporaries.
Yeah, and I bet you they have the same problem there. Yeah, so sorry about that. It happens when I'm trying to do things really quickly. So, so Deb, hopefully that answered your question there. Let's see. Jim Bland with Seniors Home Services, which is they're a company that helps people remodel and make their home more accessible. He noticed that there's no mention of companies such as ours on the Dream Team. How do you normally locate companies who provide services for accessibility, modification, equipment, what have you? But I think Jim and for Kay, I think the spirit of your Dream Team is that Dream Team is all centered around decision making so that you can help somebody with their financial situation. I'm sure you could expand that to a dream team that includes assisted living, home care, remodeling and
Aging
accessibility.
in place.
Yeah.
Yeah. Yeah.
But maybe talk about, do either of you have an anecdotal story of where you may have started working with a client and then help them through those decisions to either make their home more safe and accessible or to move to a senior living community, and how you can assist people in that area?
Well, I guess I was going to start with I typically will bring in an aging life care manager. And that's usually the person that manages the in-home grab bars. How do you modify the home to safely age in place? Because that's not my expertise. So I try to make sure I'm flipping the referral to the right person who's the expert at it at the time those choices need to be made. So those people, and I have worked with lots of, I've paid a lot of bills for home renovations. Um, but in general, I'll use another professional who will lead that choice.
Yeah, I agree, Kay. Kay, it's outside my area of expertise whether or not somebody can safely remain in their home. And that's, with being a daily money manager, I think we're very mindful of the boundaries in the work that we do, because there's when you're in somebody's home, you're seeing so many things. But so I think daily money managers are very good at recognizing when other professionals really need to be involved in to sort of give you the best possible outcome for the individual.
Yeah, great. Great. And good question, Jim. And somebody is asking, how do you become a daily money manager? What is a good background for this career?
I think I think most daily money managers have very varied backgrounds. My degrees are in music. I have a master's of music from Catholic University, and I have a master's of opera from the Curtis Institute. So my degrees are not really applicable to to a daily money management career. I'm very good with math. I'm very good with people. I do enjoy data and collating data to see what's happening in a person's financial life. And I've, over the years, just had so much experience with it. But I think a lot of people that come to this profession perhaps did this kind of work for an aging loved one, like in their personal life. And they said, well, I was really good at this and I did a good job with it. And here's this profession where you do this for other people. I think that's a lot of my staff were career professionals in the government where they were doing budgeting work, and they came to the profession because they had really good skills and they enjoyed the idea of being in a person's life where you were working in a helping capacity, which is what we do. We deliver a lot of reassurance to our clients. We go over things several times with our clients. We are not going to be impatient about being asked the same question repeatedly. It's at the end of the day, I think it's about relationships and working to get to the point where the client feels that everything's in order. So I think there's a wide variety of backgrounds.
Yeah, I would say for many of the people that work on our team, I feel like it's a calling for many people. They come to this because they've done it. And I learned so much in doing it for my parents. I felt like that was the natural progression of my life path, was to do that. But if you are interested in the profession, I'm always happy to talk to you. We are always hiring. So call me. The best way to learn is to actually go out and be on a team of people that can help teach you, because there's going to be so many things you don't know. So I love having a team environment, and I'm sure you do too, Mandy, as we have team meetings and everyone's coming at it from a different aspect. We have accountants, we have, a contracting specialist on our team. So there's so many viewpoints, and it's great to have more minds to solve a lot of problems and to learn on this journey why we're helping our clients. My favorite thing is to actually, when we get paid and they're thanking us as they're handing us money. So there's not many professions like that.
Yeah, no, that's great. And I think as we had talked about earlier, when we're talking about senior fraud, probably one of the most important things is somebody that just enjoys working with people and is a caring individual. A lot of the other skills can be learned or taught. This is great. Let's see. Christine asks, do you serve clients for all Maryland residents, and do you ever receive referrals from nursing homes when it appears that the family is overwhelmed with financial decisions and they are in need of applying for Medicaid? Many times families' children aren't willing to help. Curious if you, well, first off on Maryland, both of you serve Maryland, correct?
We do.
do.
I mean, I would specify though, like we are mostly in Montgomery and Prince George counties.
And
If
then,
I were to get, far away clients, we do serve, but only in a remote capacity. So that sometimes has limitations that an in-person work doesn't have.
And then the question, I've certainly received phone calls like this, is that do you ever get referrals from nursing homes with this overwhelmed situation where nobody can figure out who has what, and they're trying to apply for Medicare or Medicaid?
We get those referrals, yes. I will say though that sometimes the referrals come in and it's too late for us to help because it's not clear who would hire us, because if the client is not competent to hire us and nobody has any idea who's got responsibility for this individual, sometimes at that point it's very difficult for us to come in because we have to establish a relationship and have the client be clearly defined, and they have to agree to our services. So,
Right.
Yeah, I would say, I mean, I've been in that situation a few times where the community has called me in to come help. And it's been more of a pro bono situation to say, can you come in and help us? Like somebody just needs to come in, and in 2 hours we can figure out the basic landscape. And I'll do that pro bono because a good colleague has asked me to come in and help someone who's in need. So there's been situations where we've done that, but I think to Mandy's point, it's difficult because usually someone who's trying to apply for Medicaid can't afford to hire us.
Exactly. And for those of you who are in Virginia, next week, next Thursday, I'm really excited about this Medicaid waiver discussion we're going to have. So I had no idea that people could even get on Medicaid waiver, and we're going to learn about that. Well, speaking of aging life care managers, Sandy Rosengard has a question. She's from an aging life care practice in Northern Virginia, and she says, what area of Northern Virginia do you cover? I assume you're a private pay. How do you bill? Is it hourly or flat fee for your services? So thanks, Sandy, for that question. It always comes up no matter, we have aging life care, elder law. Everybody wants to know, how do you all charge and bill for your services?
Go ahead, Mandy.
would you like me to, so
Sure.
we charge on an hourly basis. We have our clients sign a letter of agreement in order to start services, and then we offer free initial consultations where we will meet with the individual in person for an hour to sort of introduce ourselves and go over the scope of the services we provide. So we bill by the hour. We send invoices once every 4 weeks. In terms of the coverage area, it's really Northern Virginia. And then there's kind of a gap until you get to Charlottesville, which is where I do in-person work. So it's a very straightforward billing scenario. We do have to charge for travel time. So we're always mindful to match our clients with a representative that is close by, but also has the skills for the situation. And then we don't charge like minimums. We don't have a contract. We have an agreement with our clients. They can end our services at any time. We have clients that we see once every 2 weeks, and then I have clients that we see once a year to help them at tax time. So we don't require our clients to have a certain number of hours. Our goal is actually always to get new clients squared away and then get the work down to an efficient, sort of planned out routine, so that they know, okay, I see my daily money manager once a month. I put everything in the basket until then, and we go through it together, and then I see them the next month. Now that's the simpler clients. Some of them need to see you every couple weeks because there's household caregivers, there's more things to work out. So it depends on what the individual needs and wants. Also, it depends on what they can afford. If they can only afford to see us once a month, I can work with them to get my hours to I can probably get my hours to a level they can afford if I can receive some mail at my office and sort of time the bills so that they're coming in at the right time of the month. So I can say, okay, on the 5th, we do this and we get it all done. So.
Yeah, and that's a common theme with all, whether it be aging life care, elder law, or move managers, is that it seems like all professions in these spaces are willing to work within somebody's budget limitations by being creative on how they're using their hours. And, Kay, on the costs, one of the, I think the neat things about your model and how you stumbled into it is you've got this book, so for somebody who may be sort of, thinking about, oh, geez, can I afford a daily money manager? They can order your book and your platform and kind of get started a little bit before they work with a money manager. But tell us a little bit about how your organization works.
So our fee structure's right spot on with what Mandy does. I actually offer a 20-minute free phone consultation, so they can go to the website and schedule that. When someone wants us to come meet with them, we do a 90-minute for $90, because I want them. We had too many situations where they insisted I go see mom or dad, and mom or dad was not interested in seeing us. So we asked them to put some money in the game to see if they're really serious about having a solution for their problem. But to your point, we do have a workbook. It's $15. So we usually, one of the conversations I have quite often with adult children is, hey, you can order this book for $15 off Amazon or from our website. Get the book, sit down with mom and dad and start the conversation. Maybe you're the right solution. So I usually like to have family members step in and fill in. And one of the only differences, and maybe Mandy, you guys do this, but I actually ask all my clients for a reporting contact. So should there be an issue, who do they trust, who I can report to, who do my invoices go to? So we have someone with some oversight over our services as well. So we try to involve more people from the family or relatives or friends, whatever they decide as we move through that process.
Yes, we do the same thing. We have something called a letter of authorization to contact, and then we ask the person to, list individuals with whom we have permission to speak and notify if, and so they can limit that to certain areas, or, I think it's really great to bring up that you do that because you talk about when you're working with a daily money manager, how do you know if this person is trustworthy? And you talk about building teams. Like, to me, in my experience, anybody that wants to exploit a senior is working towards narrowing it down so that they have all the power. And people that are looking to really serve a senior and make sure that they're really getting everything they need, those are people that the people that are really looking out for that senior. They want more people involved. They want a team. They don't want sole power over an individual, because I've had situations like that before where there was an individual in the elderly person's life who was working to get everybody out of the picture so that they were in charge. And to me, that's just a huge red flag. So I would just point that out to anybody that's looking for help in this arena, that you really want people who recognize the importance of not just one person being in charge, that you need people, you need more people. It's good.
Teamwork makes the dream work.
Yeah. There you
Okay,
go.
well, we are, once again, these hours go by so quickly. We're wrapping things up, and I've got one last question, but whenever I say that, I know we're gonna get one more that drops in there. But actually, this came in, Mandy, when you were talking about taxes. Do daily money managers help with tax returns? Like, is that something that is in your scope of work?
I don't prepare tax returns, but I work with CPAs to get them everything they need in a very organized fashion. So I will provide them with all the tax papers that they need and the substantiation and sort of the preparation of the materials they need. But I don't create the return myself.
Okay, and Kay, I'm assuming you're in the same boat.
Yeah, there are some DMMs that are CPAs and have done tax returns for clients. So some do have that designation, but we do work, we try to streamline taxes and make it easy. And it's interesting. You probably have the same situation, Mandy. For the majority of our clients, when we start helping with the tax returns, the tax return costs are lower, even including our hourly rate. Because we're able to also pull in all the deductions, and we help them write off things that they don't even realize are write-offs because they haven't been tracking it. I didn't know that. I didn't know I could write that off. Yes.
Yes.
And I just saw in chat that somebody was wondering the name of Kay's book, and correct me if I'm wrong, Kay, it's the MemoryBanc workbook.
It's MemoryBanc, your workbook for organizing life.
Oh, okay, great.
And bank is spelled with a C, so MemoryBanc.
I just dropped the link to where you can buy that off your website.
Thanks. I see that.
Okay. Wow, we did it. We got through this. Thank you to the two of you. I've again, man, I'm still a bit shocked that Mandy, that you're an opera singer. Okay, but
I'm really a daily money manager first now, but that was my.
No, I love it. And this has been a great discussion with both of you. But really, I want to thank the audience for the wonderful questions that you all provided to help us understand this profession a little bit more and how it can help older adults, clients, loved ones, anybody who's busy and may have challenge organizing their finances and paperwork. So I also just got an email that somebody jumped on late and they want a recording. Just to remind you, I put the recordings up of all of these late. This will be up later this afternoon, so you can watch it or share it or what have you. But thank you to the two.
Thank you, Steve. Thank you for shining a light on our profession. I really appreciate it.
Oh, you bet. Okay. All right. We'll see everybody later.
Bye-bye.
Thanks.